Hi, this is Dr. Caroline Kieser. I'm here at Dental Pros. This is our new podcast where we talk about anything dental related. It's called Teeth Talk with Dental Pro. I'd love to take you on a tour. We talk about crowns and veneers. We're going to be talking about kids and braces, when to start braces. We're going to be talking about holistic dentistry, green dentistry, implants, extractions, all kinds of things that are dental related. So come on down, hang out with us today.
Welcome to Teeth Talk with the Dental Pro. I'm Dr. Caroline Kieser.
I'm Dr. Kurt Kaiser.
And I'm Jordan Ochoa. So, here are the Kaisers. We need to know about their love story. How did you guys meet?
Okay. Well, we met in dental school, and Kurt was like into me, and I was kind of into him.
Oh, is this seriously?
Yeah,
Like,
why not?
This is Tooth Talk.
Yeah,
Well, technically it's Teeth
it's
Talk.
Teeth Talk.
This is Teeth Talk.
Yeah.
Kurt was really into me.
Yeah. What would you like to say?
Well, we need
Want me to
the-
be
It's
professional?
just
a
awkward. It's just
precursor.
super awkward.
Okay, fine. I'll be professional. Okay.
It's also a podcast though, so it kind of needs to be a little unprofessional.
Are we talking about the
He won't.
podcast is about like our love life?
Keep
Like,
this in here.
People like it.
who
Yeah, they
likes
do.
it?
It's
Who-
the podcast.
Who likes it?
Everyone. Potential patients. Anyway, so how did you guys meet?
We met in dental school.
That's cute.
Kurt and I sat next to each other. My maiden name was Kaiser, and his was Kieser.
Yep.
And one day I needed a refrigerator moved, and so I said, "Hey, Kurt, can you come to my house and move this refrigerator, and I'll feed you spaghetti?" And he said, "Yes." And then it was over. Spaghetti,
Spaghetti.
1-all.
There you go.
My mom always says,
There you go.
spaghetti.
Spaghetti.
Did you like my spaghetti?
The spaghetti was great.
Yeah, it's good.
He's so nervous right now.
I'm just uncomfortable talking. I thought this was like about teeth and
It is
like
about- it
phase
is
one
about teeth.
treatment. Phase one
Yeah,
treatment.
that's next.
But you guys coming together created all this, so we need to talk about the backstory. Okay, so how did Dental Pros come to be?
This is Kurt's dream, actually. He started it. He saw the vision of all-encompassing dental treatment that a lot of other dental practices weren't doing. You know, you'd come into your orthodontic appointment just to get the wires off,
Yeah.
and then you have to go all the way to your dental office, get your cleaning, and you have to come all the way back for Kurt to put the wires back on and do the adjustment. So
Yeah.
you just thought, wow, how inconvenient.
Yeah.
And that's one kid. Once you add 2, 3, 4, 5 kids on top of that, and then he came up with this idea that he wanted to do an all-encompassing dental practice.
Yeah.
Yeah, it's always been for me convenience. Caroline and I are super busy, you know, trying to plan stuff out in school with Grace, with everybody else. That I always thought, you know, how can we be more convenient for people while still giving the same level of service and quality? And I just felt like that was the transition that was going to happen, you know, over the next kind of evolution of dentistry, is to go to, instead of the smaller private office where it's a single one, to really build teams out that want to work together. And I feel like any time that you can be more convenient for a patient or a parent or anybody, that they're going to appreciate that. So that was the beginning of it. You know, we had ortho practices. We had 3 offices that were ortho practices. We started dentistry. You know, a lot of the orthodontics is also keeping the kids' teeth clean. As you go through orthodontics and you put brackets and wires on, it makes it more difficult to clean, you know, and teenagers sometimes have a hard time in general. So being able to bring dentistry in helped us to, you know, stay on top of hygiene better, allowed us to sort of remove the financial barrier too of going back and forth to get cleanings as well. So it's helped orthodontic treatment. That was the first part of it, and then we were lucky enough to get Dr. Caroline to start the oral surgery
I said yes.
piece as well.
Said
Said
yes.
yes.
Said yes again.
I said yes again.
Yes,
the
exactly.
dress
A second
and
time.
You married the practice.
Yes
Yeah.
to the dress and yes to the practice. Yeah.
Yep, and I think that's when we really started to take off. She brings a vision to it of what she wants to do clinically. She's the best clinical surgeon that I've seen, and to be able to work with that and bring that level, also to hold all of us doctors up to that level too, has been just wonderful for our practice and our business.
Well, thank you. That's really nice. The other thing is, I can't even think because that was so really nice.
That
I
was
said
really
that.
nice.
It's like really sweet. I know.
He didn't want to get sappy, but he did.
He did it. He did it. Okay. I know.
It's cute.
Okay, skipping over the wedges. The other thing that we want to highlight too is now at Dental Pros we're offering free cleanings during your active dental treatment.
Yeah.
So
Yeah.
that way, we know that your teeth are getting clean, and we can, even if you see another dentist, you'll still do your regular cleanings with them. But when you come to us, you go just get that extra cleaning, just to make sure we are teaching you how to clean between those those wires around the brackets. You can never have enough cleanings when you're in orthodontic treatment, and insurance is only going to pay for 6 months, right? So they're only going to pay for the 6 months. We said, we'll just throw in a couple free cleanings, and that way we know every 3 to 4 months we've got a patient in treatment, and their hygiene is good. We're moving teeth. It's super important that they stay on top of those cleanings, and we just want to ensure that this is going to happen.
Yeah.
And then we just incorporate that right in their adjustment appointment. So.
Yep. I feel like the results are better. The hygiene's been better. Parents are happier. Like it's been a good move all the way around for us.
I completely agree. Yeah, super convenient. 4 cleanings a year is basically what they're getting, right?
Basically.
Yeah.
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 And if they have insurance,
Yeah.
they're not paying for any of that,
Yeah.
So going forward though, there's a lot of questions like, why does my kid have to get braces on so soon? What is this phase 1 treatment that people are talking about? Kurt, can you kind of let us, kind of give us a little insight onto phase 1 treatment in a child?
Yeah. And it's a little bit tricky because it's orthodontic terminology that sometimes isn't the most straightforward, for patients and parents. And so we want to see every child as early as 7 years old for their initial orthodontic screening. And people think, are they ready for treatment? Why am I bringing them in at that age? It's not necessarily that we think that they'll need treatment, but that at that point in their growth and development, and especially on the dental development, they've hit certain milestones in which when things start going a different direction or off track, that's the time that we can recognize them at an early point in time and really manage the situation much better.
Yeah.
There's a lot of different things that we see, and most of them are fairly minor from an orthodontic standpoint. A small percentage are major. And when we do that screening, usually it's a time to come in, get used to the office, get an x-ray, get a scan, that impressionless scan that we have, and now we can see that over time. Majority of the time there isn't anything to do except talk to mom and dad, hey, here's what we're looking for.
Yeah.
Here's some potential things that may come up and we don't know, but we'll check back in 9 months to a year. There are times where we say, no, there's one of these 3 kind of major things that we look at, and when that happens, now we are actually recommending treatment because it has been shown in the literature that it is more effective and more efficient to do it at that age, because it gets the growth and development back on track. So there's about 3 different scenarios that we look at. A common one is an expander that people know about. That's going to widen out the upper jaw to make more space. Again, trying to get the growth and development of the dentition back on track. Sometimes people have what's commonly called an underbite. Sometimes there's baby teeth that don't fall out the right way that pushes the permanent teeth off track. And so it is better corrected at that age with what we call a phase 1, right, of orthodontic treatment. It typically lasts about 9 or 12 months. And then there's usually about a year or 2 in between then. And then because there's a phase 1, then we talk about a phase 2 as once the rest of the permanent teeth have come in. So when you hear phase 1 or phase 2, those are the orthodontic terminology of we did some treatment at an early age around 7 or 8. And then the second phase would be typically around 11 or 12.
You're basically just catching them from having to go through more extensive orthodontic work later.
Yeah,
Okay.
and or manage it better. I think it's kind of like a yearly checkup at the doctor, right? Even though there isn't anything, sometimes you find it and you say, let's watch that over time. And then there's other times where you say, oh man, I'm glad we caught this now. I'm glad you came in and didn't wait until this was a bigger issue before coming in.
And just so all the parents know, a scan is not radiation. So when we talk about scan or scanning someone, it is a series of multiple pictures that create an image on the screen, and which allows the doctor, either virtually or in person, to kind of review that scan with the parent to kind of go over what the dentition looks like and how the teeth are kind of popping in through the gums there.
The technology is incredible, and it really is. It takes multiple pictures, hundreds of pictures, if not thousands, pieces them together to create a 3D image of the teeth of your child or yourself, your whole teeth and dentition that we can then look at in a consultation.
Yeah.
And traditionally we used to have a picture that we would put up, and 2-dimensional, it's only one view. We now have this 3-dimensional, essentially digital model that we can show, and that has really helped improve patient communication. And number 2, there's no more impressions, which is always the best thing.
That's awesome.
I think he answered like all of these in here. Good job.
I think you did. When, just out of curiosity, I have a younger child. A lot of people have younger kids. When's the first appointment that they should make at a dental office?
First appointment for a dentist or orthodontist?
For really, like, when should we start getting them into orthopros, just so that we can catch whatever phase 1 that we need, or whatever it may be? When should they establish their new patient?
I think a lot of times, I don't think people realize that the dentist, it's not that it's scary, it's a big new building, and there's all these new people, and I've never seen them before, and I'm 1 or 2 years old.
Yeah.
The first visit really is just to pop them in the chair. Nothing bad's happening here.
Right.
They start to get familiar with the chair. Oh, the chair goes up and it goes back, and someone's gonna look at my mouth, and that was it. Okay, that's good. That's not so bad.
Yeah.
And then we do that again, and then you start to add the cleanings into it. You maybe polish the teeth a little bit, and you just talk about hygiene with the parents, and it's more about educating at the beginning, and then you slowly work into real cleanings once more of that adult dentition comes in. So I would say 1. At least just to pop them in the chair.
Pop them in.
Yeah, just to see, and orthodontically, like we were talking about, at 7 years old, and we're looking at it. Even if a parent comes in, that's why we're always going to ask, with the child, have they seen it? Just because it's such an important building trust, right, with that patient and that child, which is huge, and to see them earlier and to go to just non-invasive procedures, x-rays or a scan, and getting used to the chair has really helped out.
And we try to make it fun. I mean, we have a kids club. Jordan, you can kind of elaborate on what we do at the kids club here at Dental Pros. But I think too, like when you're coming to see the dental office and you're getting tickets and prizes.
Yeah.
And
I mean, we do a lot with Arizona Athletics and the Arizona Tucson Roadrunners as well. And the tickets, I think, are a really big, nice prize for a family of 4. They can go out and just have a really nice evening. We also do raffles every single month. So we're going to have our golden ticket thing come up in the summer. Can't elaborate too much on that because it's so special.
It's a little secret, but it's not really
secret.
top secret. But
it's a little bit.
It's
going to be fun though.
It's going to be a lot of fun. So it's going to be basically a treasure hunt.
Yeah.
And it's going to involve you and your family. And so we're excited to do that soon. But.
Yeah, there's a lot of components into it. But being part of the kids club, obviously you get your kids club bag. It has a lot of cool freebies in there, just some miscellaneous stuff, and then you're entered in every time that we're giving away tickets. I'll reach out personally, send an email and say hey, whoever responds first is going to get these tickets. Or sometimes we'll even just find a family in the office that might be having a rough day, or they've come so many times and we really want to just show our appreciation to them. So we'll pass out tickets quite regularly, just so that people can have that chance to enjoy something with their families.
Yep.
Well, thanks for hanging out with us at Teeth Talk with the Dental Pro. Basically, we talked about phase 1 treatment for your child that we like to see from ages 7 to 12. We like to see our orthodontists. Those are free at our office, so you can always give us a call at 520-290-8787. You'll see Dr. Kurt. He goes to all 3 of those locations. And I think that's pretty much it. Jordan, you have anything?
Yeah, I mean, the convenience of dental.
Blah, 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 blah. What am I called?
I keep looking at your shirt.
You're good.
The convenience of Dental Pros is that, we have those 3 locations on the north side of Tucson, the south side of Tucson, and the east side of Tucson. So wherever you're at, you're going to find a pro for you. So just make that phone call, like she said, 520-290-8787 so we can get you in and give you a free ortho consultation as well.
And thanks for stopping by.
Thank you.
Did anyone get that joke?
No.
Just be prepared for the candy in the office.
We do have a candy wall as well.
Oh, thanks for stopping by, San Diego. My God, you guys. I'm going to go check on the kids real quick.
Are you trying to be like Ron Burgundy?
Yeah.